I kind of have a role in the Myeloma Institute at University of Miami, where I'm doing sort of translational studies. So I like to work in the clinic. I see patients, and we work on some investigator-initiated studies. So studies that we think are important, that we're trying to run ourselves. And so, not to speak too much about that, but we have a couple of cool studies that are coming down the pike, where we'll be looking at novel combination therapies for patients that are having trouble in the relapse refractory setting, combining some of the drugs that we've spoken about earlier today even. Those trials will be opening sometime soon, and so we look forward really to enrolling patients in our area on these trials who otherwise might not have some of the options that you might have otherwise other areas in the country. On the other hand, I do a lot of translational work where we're looking at genomics. And so, this is a big topic in myeloma, and there are many different avenues where you can apply genomics to try and understand the disease. And so for me, my focus is trying to understand toxicity in multiple myeloma. So as we've seen multiple times, patients are suffering, unfortunately, from some secondary side effects after they get transplants or other chemotherapies. And sometimes those complications include therapy-related malignancies. And so our goal right now, and one of the primary aspects of our research, is trying to understand who is at risk for developing a secondary malignancy following some of our therapies, and how can we prevent it. So we do have a couple of studies that have recently been published looking at this. We're working on trials to evaluate this in the kind of in a forward-thinking manner. And the basic idea is that patients are doing so well with myeloma these days that we really don't want to mess that up. If patients develop a secondary malignancy while they're being treated for a disease that now has a survival greater than 10 years, we're really doing them a disservice. So it's imperative that we figure out exactly who might be a person that's going to suffer from a complication like this to really ruin all of that.